And good morning, everyone. And this is May 1st, 2020, the last day of our semester. Final exams, of course, uh, start soon. So, just want to bring you up to date on what's going on in our daily news segment of American government classes. The latest on the coronavirus is that there are 3,331,000 people worldwide who have been identified with the virus. So 3.3 million cases of the virus. Interesting little note, Madonna, the singer, she was just discovered to have the antibodies. That means that she has been exposed to the virus and apparently didn't have any symptoms from it. And that is a very common thing. We're going to discover that a lot of people have the virus, or at least have had the virus and didn't have any symptoms of it. But at the same time, the flip side of that, from not having any symptoms to 235,000 people have died from this virus. There has been more than 1 million people who've recovered from the virus. Here in the United States, we're at more than 1 million victims of the virus. And in the United States, more than 63,000 people have died from this virus. And in a typical flu season, what they say is that about 38,000 people die as a consequence of the flu. Well, in a 3 month period, in just a 3 month period, February, March, and April, we've had 63,000 Americans die of this coronavirus. It is a pretty deadly thing. And the bizarre thing about it, and we've talked about this before, the bizarre thing is that most people get the virus, nothing happens to them. About 20% get sick, really sick, and then 1% die. And that's largely dependent on the age or underlying health conditions. Okay, here in Abilene, the latest numbers are that there are 319 people with this virus. About 80, 85 have recovered. The rest are in some stage of recovery. There have been 5 deaths here in Taylor County. And what we've had is we've had some hot spots. Uh, the public health department, the fire department, the police department, in other words, all the first responders, they have been hotspots in this thing. So has Abbey Mar Foods, big food manufacturer here in town. So is Disability Resources. So, and that's with very limited testing we know of these hotspots. So it has been a real issue here. The New York Times has said that the city of Abilene is number 16 in terms of, and that's of cities in the whole United States. We're number 16 in terms of the increase in the number of cases. Cases here in Abilene are growing 11% a day. Now, with that in mind, the governor said that today ends the lockdown. And his order to be in lockdown through the month of April expires. It expired at midnight, and now we're free to move more. Stores are going to be starting to open. There's going to be some restaurant services, all within prescribed limits. But we are starting to reopen the country. Okay, lots of other things going on. You know, there's a conflict in this country between opening up quickly and opening up slowly. And yesterday in Michigan, protesters, including several who were armed, stormed the Capitol building in Lansing, Michigan, to demand that the government open the businesses, open society again. Unfortunately, none of them were wearing face coverings. And the reality is that face coverings, while they may not be very effective in preventing you from getting sick, they're very good at limiting your own virus's breath to other people. And so when you think about it, these protesters, by not wearing masks, are basically saying that they don't care about other people. If you wear a mask, you're saying, I care about other people. I mean, that's just a simple reality. The masks are really designed to keep your breath, your spit, your sneeze with you. And even if you say you don't have the disease, the reality is you don't know unless you were tested that very minute. That's the way, that's the nature of this virus. Okay, just a couple of other things I wanted to get into. Um, China, you know, President has ordered the intelligence services to look into China in regards to the coronavirus. And what did they do? What did the World Health Organization do? What did they know? When did they know it? In other words, was there a deliberate attempt on the part of China to downplay the seriousness of this virus? We'll see what the intelligence services are going to report. At the same time, the intelligence services are saying that there is no evidence that this disease was manufactured in a lab. There is some talk about the possibility that this disease was studied in a lab in Wuhan, China, and it may have escaped that lab. We have complained about that lab in the past, but there's no evidence that this was a man-made thing. Everything's, all the evidence, the genetics of it says that this was a naturally occurring thing, probably from a bat that then somehow spread from a bat to an animal that was eaten by a human being and then passed on. So, but anyway, China is also really pressing the United States in the South China Sea. And there has been a series of actions in the last couple of weeks. Remember the South China Sea, where there are these artificial islands that the Chinese have created out of nothing. Well, the United States is trying to maintain what is called freedom of navigation, where they take the boats and sail right by them. And the Chinese are claiming that they forced an American ship, and that would be the U.S. destroyer Barry. They're saying that they forced the U.S. Barry out of there. And what it turns out is U.S. Barry went one way, then turned around and went the other way, and the Chinese are saying we forced them out. So we control this. What it's about is simply about freedom of navigation, and the Chinese want to restrict navigation on the part of the United States, and we're fighting back. And so far, everything's being kept on the down low. It's not getting too excited, but this last month there was a lot of activity out there. Let's see what else. Um, oh yeah, Congress. Congress wants to get back into session. The Senate is supposed to get back into session on May 4th, so early next week, and they're going to take up the next phase of the stimulus plan. The House of Representatives was going to come back on May 4th, but decided it's not safe to come back on May 4th. So instead, they're not coming back until May 11th. The doctor for the U.S. Congress has said that their office does not have enough tests for the 100 senators in the U.S. Senate. And so therefore they don't have enough tests for them. They don't have enough tests for their staff. They don't have enough tests when the House of Representatives comes back too. And that gives you an idea about the testing capacity of the United States. Despite the words of the president who says we have plenty of testing, anybody can get a test, who wants a test can get a test. In fact, the reality is that's not the case. And the US Senate is a prime example of that. And if we're going to reopen, we need to have tests. Because when you reopen, what you do is you say, okay, those who are negative, you know, you need to protect yourself. Those who are positive, who've already had the virus, they have antibodies like Madonna, they can go about their normal life. That's really what this is all about. To do that, to open up, we really need to have tests. And we just don't have enough right now. Okay. Congress, when they come back, they are going to be taking up the idea of a next set of stimulus to help cities and counties. Speaker Nancy Pelosi wants $1 trillion in aid for cities and counties. This is after we spent $2.2 trillion on the first stimulus that led to some people getting checks. And then we spent $500 billion on another stimulus to help businesses. Now, state and local governments are really hurting. And the question is, are they going to get aid? Um, Republicans and Democrats are going to argue about this, probably going to take a month or so, and we'll see what's going to happen. What they're arguing about is a very simple concept. They're arguing whether a business that opens up can be sued if one of their employees gets sick from the coronavirus. So what they're arguing about is what's called liability. And the Republicans want to protect that business owner, and the Democrats want to protect the workers. Okay, and we'll see where this is all going to come up, but it's probably going to take all the way through the month of May to really resolve that. Finally, last little point, people are talking about what the future is going to be like. Well, here's one of the things. If we go back to having sporting events, one of the possibilities is that we'll have to wear masks if we're at a sporting event, and we won't be allowed to yell. If you can imagine that, we won't be allowed to yell. Why is that? When we yell, our spit comes out. Okay? Our breath comes out. Water droplets comes out. And those can spread the virus, even with a mask. So, one of the possibilities people are thinking about is you just don't have yelling at sporting events. I'm having difficulty imagining such a thing, but that's what the public health people are talking about. Okay, that's it. Take care. Bye.